guys, welcome to our drug project. This is presented by me, Isabella, and Michelle Horton. So our drug is Versigua. Brand name is Verquvo. Its release date is January 20th, 2021. It's a vasodilator, and the pharmacological class is soluble guanylate cyclase stimulator. The active ingredient in that is methylcarbamate. There's only one route to this drug, which is by mouth. And every dose will start with a 2.5 milligram dosage, and it will, every 2 weeks, you will titrate up from 2.5 to 5 and then 10 milligrams, and that's the maximum maintenance dosage. It's used to reduce the risk of cardiovascular death in chronic heart failure patients who have an ejection fraction less than 45%. So we're going to go into the mode of action. So Versigua is a SGC stimulator, which is just a fancy way of saying that it stimulates the SGC protein to bind to nitric oxide. And this synthesizes and stimulates the cGMP process, which increases cGMP levels. And that is a protein responsible for vasodilation, smooth muscle relaxation, and overall improved cardiac function. So in patients who have heart failure, there's a lot of oxidative stress going on and vascular dysfunction, which causes depletion of SGC in the body, intracellular SGC and nitrous oxide. And that leads to a lot of our myocardial dysfunction. But when you give a patient this SGC stimulator, which helps bind to nitrous oxide and increases cGMP levels, it regulates the body, it regulates the heart, and vasodilates the coronary arteries, and helps improve blood flow throughout the body into the heart. Another thing is Versigua, it doesn't need to bind to nitrous oxide. It can work with or without NO to work, and it can work with or without it to increase CGMP levels. So it's pretty independent. Some adverse reactions are hypotension and anemia. Side effects are lightheadedness, pale skin, unusual tiredness, and cold extremities. Contraindications to this drug are pregnant women, because this drug is a teratogenic medication, and it can cause serious birth defects. And then some other contraindications are SGC stimulators and phosphodiesterase inhibitors. That would just lead to increased risk of hypotension. So touching on this again, we know that Verquvo is very, very dangerous for mothers who are expecting, or female patients who are expecting to have babies. We just want to do some patient education and let them know that if they are planning to have a baby, this is not the drug for them. We encourage them to use an effective form of contraception throughout their medication usage, and even up to 1 month after the end of their medication use. Also, we want them to take a pregnancy test just to be sure that they're not pregnant. So this is a video that explains the mode of action for this drug a lot better than I can explain it with words.
Patients with symptomatic chronic heart failure with reduced ejection fraction, HFrEF, suffer from irregularities in cardiac contractility, cardiac remodeling, and vascular tone. The nitric oxide, soluble guanylate cyclase, cyclic guanosine monophosphate pathway plays a key role in the pathophysiology of heart failure. The progression of heart failure is due, in part, to low nitric oxide bioavailability, decreased SGC activity, and reduced cGMP synthesis. Verquvo, vericiguat, is a direct SGC stimulator that works synergistically with and independently of NO to increase intracellular cGMP production. By increasing intracellular cGMP levels, Verquvo has been shown to lead to vasodilation and smooth muscle relaxation and may improve cardiac function.
Okay, great. All right, so moving on to clinical trials. So there was an experiment done between a huge group of people, half of which took Verquvo and the other half took a sugar pill. So sample size of the Verquvo patients, 2,519. 16% of that population experienced hypotension. And 15% of the placebo population experienced hypertension as well. And so that kind of shows you that there's not a huge, there's not a lot of data that points us to believe that Verquvo has a significant impact on causing hypotension, because both populations experienced hypotension, the one on Verquvo and the one taking the sugar pill. So it's not a significant impact on hypotension, or it doesn't have a significant effect of hypotension. So, but with anemia, we see 10% experienced anemia on Verquvo and 7% on the sugar pill experienced anemia. So that kind of shows you that Verquvo might have more of a significant impact on our bodies, causing anemia. The statistical significance in these clinical trials consisted of 5,050 patients, both men and women ranging from ages of 23 to 98 years old with worsening heart failure. And these trials were conducted across 694 sites in 42 countries, which included Europe, Asia, North, and South America. I'll let you look through that for a little bit. Okay, so the pros and cons of Verquvo. It helps you live longer if you have heart failure. It can lessen your hospitalizations and also the cost of that. That can be a huge deal too. It can be crushed and mixed with water if you have trouble swallowing whole tablets. And it only needs to be taken once a day. The cons is that it's very expensive, it's not safe for pregnancy or breastfeeding, and it can't be used in children. Some tips for administering this med. So you want to tell your patient to take it with food. They encourage it to have you swallow the tablet whole, but as stated previously, you can also mix it and crush it with water. Also, if you take the missed dose, or if you forget to take your dose for the day, just remember to take it that day, and not to double up to try to make up for a lost day. Do not take 2 doses on the same day to make up for the missed dose, because that would lead to extreme hypotension, which is really bad. Some nursing assessments. The typical signs and symptoms of anemia and hypotension are listed there. Some interventions for us to do. We want to assess our patient's adherence to the medication. We want to make sure that they're taking it. So just double down on education. Make sure that they have adequate resources and help to answer their questions, and make sure that they know when and how to take it. If they need, some some helpful tools and tips to remember to take their medication, help them with their process, and some tips to medication taking reminders. Yeah. Last thing, some nurses are huge on medication reconciliation. We want to check and see what prescriptions our patients already taking. If they are taking any SGC stimulators, that's not good because we don't want to double up on an SGC stimulator. Verquvo is already an SGC. So also, if they're taking a phosphodiesterase inhibitor, we want to make sure that that's off the list because both of these medications puts our patient at risk for major hypotension. A memory aid to help us remember what we just learned is cats and hats. So it starts off with cGMP levels are increased because of this medication, which helps to cause arterial vasodilation. Our maintenance dose is 10 milligrams, and it's a smooth muscle relaxant. So we got through CATS. The second half of this is all the downsides to the medication, so the adverse reactions. It causes hypotension, anemia, it's toxic to the fetus, and SGC stimulators should be avoided. Okay, our NCLEX style question. So Miss Jones is a 38-year-old woman, and her 27-year-old fiance are at a follow-up appointment with her PCP after being released from the hospital from the third heart attack she experienced last week and recently got prescribed Verquvo. What patient education takes precedence in this scenario? A. Encourage increasing daily intake of dark green leafy vegetables to avoid anemic episodes. B. Tell patient to swallow tablet whole. She can crush and mix with water if desired. C. Instruct patient to take missed dose if she remembered on the same day of missed dose, and avoid taking 2 doses on the same day. Or D. Instruct patient to use effective contraception during therapy and for 1 month after final dose. Okay, our answer is instruct patient to use effective contraception during therapy and for 1 month after final dose. It will be most important to advise the couple to use effective forms of contraception to prevent fetal toxicity. Yeah, a lot of the trials that this company did, they didn't do any human trials on pregnant women, but they did do a lot of their studies on animals, on pregnant rabbits. And a lot of that resulted in heart malformations and valve dysfunction. And so, yeah, it's really important that we make sure that this newlywed couple is not planning on having children anytime soon, because of course it would put them at risk for their fetus at risk for abnormalities. Yeah, and also encourage them to take a pregnancy test and to take contraception throughout their regimen and 1 month after they're done with that regimen. Here's our works cited.